How can AI help in the detection of diabetes using a person's voice? Welcome back to Techstination. I'm Fred Fishkin. Joining us from the Luxembourg Institute of Health is the director of the Department of Precision Health, Dr. Guy Fagherazzi. Thanks for taking the time with us.
Hello, nice to meet you. Happy to be here.
Well, I hope I have all the pronunciations correct so
That's
far.
correct. All good.
Let's start with an overview of the work you and your team at the Institute's Deep Digital Phenotyping Research Unit have been doing. Can a person's voice really reveal whether he has diabetes and perhaps other conditions?
Yes, this is a very exciting research field. Voice is a very powerful source of information when you know how to analyze and how to extract information. When you have a disease, when you have a symptom, this will have an impact on how your voice is produced. And sometimes it's very subtle, so small changes in your voice. But now, with all the technologies we have, the development of AI, we can extract thousands and thousands of variables, information that we can use to feed AI models and detect whether you have a condition like diabetes, but also mental health, respiratory diseases, Parkinson's disease. There are many applications in development for this new technology.
That is so exciting. So, describe for us in a bit more detail, perhaps, how this works and the role of AI. Kind of step us through here.
It's very simple. When we start by recording the voice of patients with the disease of interest. Here it's type 2 diabetes, and we record people without the disease with the same voice recording task. And in that particular case, it was reading a pre-specified text for like 25 to 30 seconds. And from this structured information, we extract thousands and thousands of information that we pre-process, we analyze, and we feed to AI model to predict whether this voice is coming from a person with diabetes or with no diabetes. And we managed to train AI models with an accuracy, a precision of roughly 75%, meaning in 3 out of 4 times we managed to classify correctly whether the person has or does not have type 2 diabetes.
And how do we improve that statistic? Is it just through more sampling?
More sampling will definitely help, for sure. But what we need to understand is the objective at the end is to develop a screening solution for diabetes. It will never replace a diagnosis of type 2 diabetes because that's not the objective, and voice is not specific enough to replace one day a typical blood measurement of your HbA1c or your glycemic levels. That's not the objective at all. We will never replace this. This will always remain the official diagnosis method. On the other hand, there is a huge undiagnosed cases population in the diabetes population worldwide. When you look right now, it's about 800 million of people living with diabetes in the world at the moment, and half of them, they ignore they have the disease because they have not been diagnosed properly. So there is a huge challenge to reduce this number, and we need to change the way we screen for diabetes. And voice-based solutions, like the one we are developing right now, could help for the screening part. So we want to maximize this number to get better and better with more sampling, of course, but we will never reach 95, 98, or even 100% of accuracy. This will never be the case, and it's not the objective. But we want to be as better as good as possible.
So the many people, maybe 400 million or so, who are undiagnosed, this could help in perhaps three-quarters of the cases in being able to say you should be screened further, you likely have diabetes?
Exactly, that's the objective, because right now the way the screening solutions are implemented, it's either based on questionnaires that are quite boring or difficult to fill in, or with lab measurements. And in some settings, it's very difficult because you don't have access to a proper healthcare system or labs close to where you live. So there is a need to have more scalable solutions, and the one we develop right now could be deployed very easily on everyone's smartphones. And you could have this as a first line screening solution. And if you have a high risk detected by your voice analysis, then you could be referred to going to a proper lab, to going to your GP or to the hospital.
So is the goal then to create an app that would be available that people could use and it would tell them that they likely have?
That's one way to implement this technology and this algorithm we are developing right now, an app that could be on everyone's smartphone. Yes, for sure. It can also be implemented in call centers, for instance. It can be implemented in telemonitoring or telehealth solutions in the future. There are many ways to record voice in the real life. And as soon as you can access to voice recordings from the population, you could imagine having this solution integrated as well.
And unlike waiting for blood work lab results to come back, you would know pretty
Exactly.
quickly.
Yeah, absolutely. That's the idea.
And I understand there are other diseases that this technology can be used for, perhaps.
Yes.
Tell me about it.
I think like 30 years ago, this started with the field of research in neurological disorders like Parkinson's disease. Even 30 years ago, on the landline phone, the clinicians were calling their patients to listen to their voice as a way to assess disease progression, whether Parkinson's disease has evolved over time. Right now, we have much more an easier access to voice recordings because we have smartphones, we have new technologies, and we have AI. So that means we can imagine deploying this technology to many other outcomes than Parkinson's disease. Parkinson's, it's obvious because when you have this neurodegeneration, there is a direct impact on how your voice is produced and how you sound. But in other diseases like respiratory diseases, asthma, COPD, mental health, depression, for instance, you have a direct impact on your voice production. And now, with the technologies at our disposal, we can capture these subtle changes. So the applications are very diverse in all research fields. You can also track symptoms, for instance, like fatigue, pain, um, distress, stress, anxiety. All of these dimensions are somewhat reflected in your voice.
Interesting. Now, all of us have friends and loved ones, and we were on the phone with them or something, or speaking with them in person, and you hear something in their voice, and you say, "What's wrong? There's something wrong." I guess we're processing what we're hearing too in the same way in some respects that AI does.
Exactly. That was the starting point actually. When you have someone on the phone that you know and you can detect some changes, this usually indicates changes in their mental health, their mental fitness, their fatigue, their emotions. And now we want to objectivize this basically. We want to have, there are two lines of research in the field of voice AI and vocal biomarkers, either relying on a one-shot recording. You have a voice recording from someone you don't know, and you try to predict whether he or she has a disease or a symptom. So that's one way. The second aspect is for monitoring patients, for instance, where you would have regularly several voice recordings over time, and you look at the evolution of voice features, voice characteristics in the same patient. The patient is his own control, basically. And this is exactly the same situation as when you call someone you know. You have previous recordings in your mind, you know how this person is supposed to sound, and you detect differences. And this indicates usually that there is something wrong.
Sort of like a baseline ECG.
Exactly. Exactly. That's the idea.
So I understand that you have been working with people online who can contribute their voices to help with this research. Tell us about that.
Yes. All of this research is based on the huge investment to collect voice all over the world. This is a study called Co-Live Voice, where basically people, they don't need to have any specific disease. We are targeting health in general, not just a specific disease like diabetes. They can donate their voice for research. You have the collivoice.org website. You can click on I want to participate. You have the consent form, a few questions about your health status, the disease you have, the drugs you may use, and some questionnaires. And at the end, you have very cool voice recordings to perform. And this is the basis for our research. Then we use the recordings and the information you have shared with us to develop these new technologies.
When you're unwell, it can affect certain organs. Being unwell can affect your voice because all these organs are involved in producing the sound. Therefore, signals from your voice can predict symptoms. These are called vocal biomarkers. In future, identifying vocal biomarkers will allow doctors to treat disease more effectively. 50-year-old Jack has type 1 diabetes, which requires him to use an insulin pump to manage his condition. Managing his condition causes him to suffer with anxiety and depression. Jack's doctor refers him to a psychologist. He monitors Jack's mental health by getting him to make a weekly voice recording on the smartwatch app Jack already uses to monitor his blood glucose. To help people like Jack, we're creating a multilingual voice database. First, we need to make recordings so we can process and analyze the voice. Next, we extract thousands of audio features from the recording. We also convert it into a spectrogram. These are then fed into AI models to predict whether the individual has a certain symptom or disease. This involves collecting voice recordings and data through a survey on the Collai Voices app. Anyone over the age of 15, regardless of health status, can participate. All you need to do is answer a health questionnaire and provide 5 short voice recordings. Participation is anonymous. The more diverse the data, the more inclusive the digital health solution will be. We need data from males and females of all ages who speak different languages with different accents. Donate your voice and share this video with your friends and family today.
This donation, so to speak, doesn't hurt at all.
No, it's not. You can do it.
Done anonymously?
It's completely anonymous. We cannot trace back who shared information, so it's completely safe. And you can do it on your smartphone, on the laptop with a microphone, wherever you want. You just need to be in a more or less quiet place, quiet room. And it's very short. It takes 20 to 30 minutes to fill in, and you have a huge contribution to innovative research.
And how important is it to get large numbers of people involved here? From all over, right?
Yeah, as any research field using AI, the more the better, because we can cover all the situations if we have larger and more diverse samples and populations. With voice in particular, this is all the more important that when you have an older person, a younger person, a female, a male, according to the language, your accent you may have, all of these factors play a role, of course, in your voice production. So we need to cover all of these situations to be as universal as possible. That's why we need big numbers, and that's why we are always calling for more donations of voice and contribution to Collai Voice.
Tell us, if you will, about your inspiration for focusing on this type of research.
By background, I'm a researcher in epidemiology. That means I'm interested in identification of risk factors, how to prevent disease, how to help patients to get better or to reduce the risk of complications. And I've always been fascinated by new technologies and new ways to conduct and collect information for medical research. Over the years in my career, I've developed some new ways to collect data in patients using digital technologies. And voice was really turning point for me in my career during COVID, during the COVID-19 pandemic. We operated a shift in how we collect data. Of course, during the COVID-19 pandemic, it was important to stay as far as possible of the patients to avoid contamination, to improve the remote monitoring of patients. And this is where voice became a really important topic. And we picked this up in 2019 and 2020. For COVID-19, of course, we had many research projects in COVID-19, But we also extended this research to many other conditions because we saw the potential of voice analysis for other chronic diseases. So that's the starting point, and that's how we have been inspired to get into it.
Can COVID be detected through a person's voice?
There was some good indication back then that indeed people with COVID-19, especially with fatigue, with coughing and everything, have a different voice signature than people without COVID-19. So there was a lot of research, not from my lab, but from others. They have developed some detection systems with just a few seconds of voice recordings. However, we never reached the phase of an implementation in clinical practice. This never happened. But the technology, the methods, the algorithms, everything we learned is now contributing to the research in other diseases as well.
So, using the research that you've done and the continuing work gathering voices and such, when can we expect that this will actually be widely available and implemented?
The research field of vocal biomarkers and voice AI is very young, very immature, but now it's booming and it goes at a very fast pace. The first products using voice, maybe not vocal biomarkers that are validated, are already on the market, but very few are approved by the FDA or the EMA in Europe, for instance. So we can expect many more developments, many more products in the field of voice AI and vocal biomarkers in the next 5 years. In 5 years from now, it's expected that we will have some voice-based solutions integrated in clinical practice for some diseases or some use cases. For instance, Parkinson's disease, as I've mentioned before, is definitely the number one outcome where voice can be even used one day for diagnosis, not just detection or monitoring, but also even diagnosis at some point. Other voice-based applications could be used during consultations between a healthcare professional and a patient to listen passively to the consultation and detect some health-based information. So all of this is currently happening, and there are many, many startups and research labs working on it.
More and more AI is being integrated, and it's just really getting started into the smart speakers that so many of us have in our homes. You envision that one of these days, when I say good morning to a smart speaker, it's going to say, "Hey, Fred, you better get checked." It sounds like something's going on.
This is clearly one of the applications everyone is foreseeing, is to use smart speakers or smart mirrors, also even now in the future, using voice analysis and vocal biomarkers. I think this is fascinating, but I'm also at the same time quite worried about how these technologies will be implemented, because it's crucial for me that the patients or the users will have the full control on how their voice is analyzed, the consent they will have to give before the voice analysis, to not being listened passively without their consent. So there is a lot of ethical concerns around these technologies and how to implement them. So it's very important to make sure the patients or the users are informed, they consent, and it's used in a very ethical and safe fashion.
Will the compute power necessarily come from these big corporations that have been putting all of the AI together?
This, of course, is a major driving force in the ecosystem. It will help the implementation, it will help further development, because voice alone will have many applications. But when you look even beyond this, it's the combination of different signals, different voice, sound, images, videos, and then you need very big computing power. And the new technologies and the big companies developing them will be key players for sure in this ecosystem.
Very interesting. So the thinking is within 5 years or so, maybe we'll have
even
on our
before.
phones that
Absolutely.
will be able to help with the diagnosis.
For diabetes, yes, we are working very hard to have follow-up studies to validate the technology in different groups to make sure it's safe for everyone, and we will test the implementation as soon as possible. And for other diseases, it might come even sooner than in the next 5 years.
Just wonderful. Where can people go for more information and also perhaps to donate their voices?
Colivoice.org is the place to go when you want to donate your voice, contribute to the health research on vocal biomarkers, and everything is very easy, straightforward. Just go to the website and you can donate your phone from your smartphone, your laptop. As soon as you have access to a microphone, it's easy to do.
And to follow the work that you're doing, where's the best place for people to go?
I think the website lih.lu, as we are based in Luxembourg, is the best place to go because we are posting every new publications, every new research in this on this website.
Dr. Guy Fagherazzi, thank you so much for spending time with us, and congratulations on the work that you and your team are doing.
Thank you for having me.